Hello, my name is Anna and I'm a nursing student at the University of Michigan. I'm going to present a patient to you. Patient is a 19-year-old Asian female. Patient is not married and is currently a student at the University of Michigan. Patient usually sees a primary healthcare physician in Boston. Patient's chief complaint is vertigo with migraines. History of present illness. Patient was diagnosed with vertigo in August of 2014. Patient suffers from dizziness and headaches during fast motion, and often the headaches turn into severe migraines. Patient rates pain as a 7 out of 10. Patient feels pain on the side of the head and the pain extends over the forehead. Patient describes pain as a shooting pain. Patient says pain lasts for about an hour if medication is taken. Migraines with vertigo occur 2 to 5 times a week. Patient says medication alleviates pain as well as sleep. Running, fast motions, and excessive screen usage make pain worse. Patient also reports nausea associated with the migraines. Patient treats vertigo and migraines with medication prescribed by her primary care physician when first diagnosed in 2014. Patient also reports that the vertigo and migraines do interfere with her everyday activities because upon onset, sleep is essential to alleviate the pain. Vital signs. Patient's vital signs are stable and within normal limits. Temperature, 98.1 degrees Fahrenheit taken orally. Blood pressure, 112/72. Pulse, 78. Respiratory rate, 14. Past medical history. Patient had no serious childhood illnesses. Patient does have a chronic illness. Patient was diagnosed with asthma in 2011 and irritable bowel syndrome, or IBS, in November of 2015. Patient reports no psychological history. Patient is up to date on immunizations, and patient has no known drug allergies but is allergic to dairy. Past hospitalizations and surgeries. Patient reports never being hospitalized. Patient has had 2 surgeries, one being an oral surgery in October of 2008, the other being a surgery on the right knee in February of 2015. Medications. Patient currently takes 3 medications, the first being an albuterol inhaler for asthma taken as needed. The second is amitriptyline 50 milligrams taken once a day to help with IBS, which is induced by anxiety. Lastly, 1 milligram of rizatriptan is taken when migraines occur and can be repeated every 2 hours until symptoms are no longer present. Functional assessment. Patient denies tobacco and illicit drug use. Patient does not drink. Patient exercises regularly and reports eating a healthy diet. Patient also reports a healthy sleep schedule and averages 7 hours a night. Patient's caffeine intake is 1 cup of coffee once a week. Patient also reports always wearing a seatbelt in the car and does not text and drive. Psychosocial. Patient lives in Boston with parents. Patient's siblings are alive but do not live at home. Patient and her family are very religious and identify as Islam. Patient is currently working towards a bachelor's degree at the University of Michigan and is hoping to get into the Ross School of Business. Patient has not perceived environmental hazards where she lives. Patient is often stressed by school, but patient reports having a good social life and several close friends. Family history. Patient's father has high cholesterol. Patient's mother has high blood sugar, Meniere's disease, and a lactose intolerance. Patient's siblings have POCS and celiac disease. Patient's maternal grandfather had diabetes and died of a heart attack in 2005. Patient's maternal grandmother was also diabetic. Patient's paternal grandfather has high cholesterol and had a heart attack due to a blockage. Finally, patient's paternal grandmother has dementia. Musculoskeletal. Given my patient's history of vertigo, it is essential that I assess their musculoskeletal system as vertigo can affect balance and movement. Subjective data. Patient reports joint pain in right knee due to knee surgery in 2015. Patient also reports redness and deformity in both feet due to bunions. Patient reports no restrictions on her range of motion. Patient reports no muscle weakness or cramps, as well as no bone fractures, sprains, or dislocations. Patient does not have a history of neuromuscular disorders, nor does her family. Patient has no limitations in self-care and does not use any mobility aids. Patient exercises regularly and experiences no pain when doing so. Objective data. Patient had an erect posture and an even gait. Patient's muscles were equal in size and shape bilaterally. Patient's extremities were of an equal length and arm span was equal to height. Patient's spine was midline and no cervical, thoracic, or lumbar curves were present. Scapulae, iliac crest, and gluteal folds level. Patient had an active and complete range of motion in all joints. Redness noted in feet, and patient reported pain when moving right knee. Patient rated pain as a 4 out of 10. Patient's muscle strength was equal bilaterally, and movements against resistance were smooth and symmetric. Muscle strength was rated as a 5. Patient has a full range of motion against gravity with full resistance. It is also essential that I assess my patient's neurological system because of the migraines associated with the vertigo. Subjective data. Patient reports headaches up to 5 times a week due to vertigo. They are often migraines and must be treated with medication and sleep. Patient reports no known head injuries. Patient reports vertigo, which is induced during fast movements or getting up too quickly. Patient reports no changes in vision, hearing, smell, taste, or touch. Patient reports never having a seizure or tremors. Patient reports no weakness but a lack of coordination associated with her vertigo. Patient has no numbness or tingling and does not have difficulty swallowing or speaking. Patient has no history or neurological disorders. Patient's grandmother has dementia. Objective data. Patient was well groomed and appropriately attired. Patient's facial expression corresponded to the content and topic of discussion. Patient's speech was clear and normal paced. Patient was oriented to person, place, and time. Patient can respond to questions and directions. Patient had an intact short and long-term memory. Patient was capable of abstract thinking and could perform calculations. Patient's motor function was intact, gait was smooth and coordinated. Patient had no excessive swaying or loss of balance on Romberg test. Patient's fine motor skills were smooth and coordinated. Patient has adequate sensory function and was able to ID pain, heat, and cold. Patient was able to sense vibrations and determine between place and points of touch on the body. There was no sign of Babinski reflex or ankylosing. Patient's reflexes were present and 2+ in all areas. Pertinent System 1, respiratory. According to a 2004 article by the Journal of Allergy and Clinical Immunology, high amounts of exercise, especially running, can increase your risk of death due to an asthma attack. Risk factors included age, less than 20, and running more than 5 miles at a time. Because of my patient's age, history of asthma, and running habits, it is important that I assess her respiratory function. Pertinent System 2, abdominal. According to an article by the American Journal of Clinical Nutrition, irritable bowel syndrome is characterized by unexplainable, frequent stomach pain and cramping. According to the article, females and people with a lactose intolerance have a higher percentage of IBS. Due to my patient's age, lactose intolerance, and history of IBS, it is essential that I assess her abdominal system.